On completion of this module, you will understand the importance of the wound healing process within a holistic wound assessment, the functions and anatomy of the skin, healing by primary and secondary intention, the 4 phases of wound healing, how each phase of wound healing relates to a simple analogy, the significance of each phase to practice, other important considerations for wound healing. At the end of the module, you can take a short assessment to check your understanding of the module's contents. Another day at the office for team wound healing, and despite what you see now, when it's time to get to work, this team runs like clockwork. You see, the wound healing process is a highly coordinated one, a series of events that triggers when you have a wound, and every member of the team plays their part. Yes, even them. The process has 4 phases, and each team member is well trained and well drilled in their phase, so when the alarm rings, they fall in line. But before you can understand the healing process, you need to understand the skin, where it all happens. The anatomy of the skin is an amazing and wonderful thing, and once you know your way in and around it, you can begin to appreciate the physiology of wound healing. The skin has 5 major functions. It acts as a barrier to microorganisms in the environment. It regulates temperature and excretion. It protects the body from ultraviolet radiation. It synthesizes vitamin D, and it acts as a form of sensory perception and communication. That's what makes the skin so important. It is the largest organ. It makes up roughly 16% of your body weight and needs to remain intact to allow the body to perform those functions, which is why proper wound healing is vital. Level 1, the epidermis. Comprised of dead flat cells, on most of the body it's thin, 0.1 mm, but 1.2 mm thick on your palms and the soles of your feet. The epidermis has no direct blood supply and receives nutrients and oxygen by diffusion from the dermis. Level 2, the dermis. The second layer contains blood vessels, nerves and cells, and the structures responsible for the functions of the skin. All of this against fibrous proteins of collagen that holds the body together, and elastin that gives flexibility and elasticity. Level 3, the subcutaneous tissue. The deepest, densest layer, made up of adipose and connective tissue that contains and protects larger blood vessels and nerves, anchoring the skin, allowing for some movement. And now you know what you need to know about the skin, it's time to watch the wound healing team in action. A burnt hand, a wound most of us have or will experience several times. Wounds are usually divided into acute and chronic. This is an acute wound, a wound with minimal tissue loss that will only take a short amount of time to heal through primary intention. A chronic wound, like a leg ulcer, heals through secondary intention and takes a lot longer to heal. So, let's take a look at how the team is getting on. It's all hands on deck. Every team member assembles, preparing to play their part. To get this done, it's going to need the team to operate in 4 phases. Phase 1, inflammation. Phase 2, destruction. Phase 3, proliferation. And Phase 4, maturation. Wound healing team deploy! Phase 1. The team arrives on the scene, ready to tackle the wound via the process of inflammation, specifically hemostasis, which arrests the loss of blood. Platelets release factors that result in vasoconstriction and the formation of a platelet plug. This is normally a 3 to 5 day process, but longer in chronic wounds. Without this inflammation, healing would not occur. So without Phase 1, there are no other phases.
It is important to recognise the signs of inflammation in your patients and remember it's a normal reaction to injury that brings healing cells to the wound bed to start tissue repair. Inflammation is recognised by watery exudate, redness, heat and swelling that occurs soon after injury. Its aim is to remove debris from the wound bed by bringing immune cells to the site and clean it in preparation for the next phase of healing. These signs and symptoms show that inflammation is working and should diminish as the wound progresses. Remember though, that inflammation may not be as obvious in patients with a suppressed immune system caused by medication or conditions like diabetes. Some wounds can become stuck in the inflammatory phase of healing, failing to progress to the next stage of tissue repair and becoming chronic as they can't heal.
Which brings us to phase 2, destruction. It's time to get rid of the wound debris to prevent infection. The white cells, or neutrophils, infiltrate the wound in numbers to destroy bacteria and debris, and they bring something with them, monocytes. Monocytes transform into macrophages, continuing the cleaning activity, which is essential if the healing process is going to progress.
The immune cells brought to the wound are needed for the next stage of healing, the destructive phase. At this stage, dead tissue in the wound needs to be removed, and white cells present in the wound help by engulfing and digesting devitalised tissue and wound debris, while wound exudate helps to soften and moisten the tissue. This process is known as autolytic debridement and can be helped along by the use of dressings or other debridement methods that quickly rid the wound of dead tissue. Dead or devitalised tissue can be seen as black, grey or yellow tissue present in some or all of the wound bed. It may be dry, leathery and stuck to the wound, or loose, stringy and slimy. Colour is the best visual aid in recognising which tissue needs removing, so that healing can progress and infection is avoided.
Phase 3 is proliferation, the restoration of the wound area to its former structure. The macrophages begin to release a growth factor that stimulates the formulation of new blood vessels, delivering oxygen and nutrients to the new tissue. Scaffolding, in the form of capillaries, join together to develop granulation tissue. Fibroblasts start to divide and produce collagen, giving the wound strength and elasticity. This process normally lasts 3 to 24 days in an acute wound, like the burn our team is tackling now.
During proliferation, the wound is filled with collagen and an extracellular matrix that together form granulation tissue. Normal granulation tissue is pink or red in colour and looks bumpy and uneven. These bumps are caused by new blood vessels, which are made to supply the new tissue with nutrients, oxygen, and other components essential to healing. Healthy granulation tissue should not bleed easily, and if it does, or if it is dark red or dusky in colour, it may be a sign of infection or reduced blood supply. When the wound bed is filled with granulation tissue, epithelial cells will travel over it, migrating from the healthy skin surrounding the wound until the wound is closed and the skin integrity is restored. It is important to protect these fragile new tissues from drying out and further damage.
Now onto the final phase, phase 4, maturation. This can last anywhere between 21 days and 2 years. This is where the new skin regains approximately 80% of its original strength. Some of the fibroblasts change to myofibroblasts, pulling the wound's edges closer together in a process called contraction. Once this has begun, new epithelial cells will migrate from the wound edge, as well as any hair follicles, sebaceous and sweat glands, resuming their normal duty. Another all-star job completed by the all-stars of the wound healing team. And off they go, ready to rest up, ready to fight another wound on another day.
You might think there isn't much to see during maturation. This is the phase of healing that mainly occurs under the skin's surface once the wound is closed and is probably the least understood of all the phases. During maturation, the wound deficit is closed with scar tissue present, but the immature tissue is reorganised to become stronger. Collagen is laid down in a disorganised way during proliferation, but during maturation it is rearranged and cross-linked to make it stronger. This process can take up to 2 years, and when complete, the skin will have 80% strength of uninjured skin.
Also important to remember that even though the wound healing team are the body's superheroes, there are other factors that can aid or impede them. As with anything related to the body, good overall health is key, and that's how people can become good sidekicks to the superheroes in their own bodies. For most, wound healing is straightforward, but for patients with chronic wounds or pre-existing conditions, healing can become prolonged and adversely affect a patient's well-being. That's why it is important for healthcare professionals delivering wound care to recognise the 4 phases so that they can monitor wound progress and ensure that the wound healing team is getting on as they should. Thank you for watching The Adventures of Wound Healing Team. It's now test time to see if you learned how and why they work.